It's predicting a remarkably rapid increase in the number of cases. And that in itself is worrisome. We don't know the relationship between this variant yet and long COVID or post-acute COVID. And so you are putting a whole bunch of people at potential risk. Earlier variants had a risk of long COVID of perhaps maybe 10% with different types of symptoms. At the same time, if our assumptions about severity are right, you'll also see a huge increase in hospitalization, which is challenging to manage with consequences for health. And if the assumptions are correct, an increase in ICU use to the point that the ICUs are unsustainable, likely sometime in January.
Ontario's COVID-19 Science Advisory Table is calling for more strict public health measures to combat a surge of Omicron cases. The panel of experts says without further measures, we could see more than 10,000 new cases each day by Christmas, and ICU admissions could reach unsustainable levels by January.
The table says boosters aren't enough, that we need a circuit breaker to blunt the impact of Omicron, which includes cutting our personal contacts by half. Joining us live now tonight with more on this is internist at St. Michael's Hospital, Dr. Fahad Razak, along with critical care physician at UHN, Dr. Barrett. Both are members of Ontario's COVID-19 Science Advisory Table. We also have Colin Furness, an infection control epidemiologist at the University of Toronto. Welcome to all of you. Thanks for being here. Dr. Razak, I'll start with you. The big message today is we cannot vaccinate our way out of this wave. So will this fifth wave be the worst?
Unfortunately, all evidence we have suggests that it's going to be. And I think what you heard from Dr. Brown was a very sobering message about what realistically can be done. This wave is well underway. It's really about trying to reduce the intensity of it, the number of people who are sickened by it, and the effect on our healthcare system. You cannot do that with vaccines. Vaccines probably take, even in that third dose, will take a couple of weeks to really give you sufficient protection. We're well underway. We had a jump in about 1,000 in our number of cases just from yesterday to today. The percent positivity skyrocketed. So we're well underway. You cannot stop that with vaccines alone. Vaccines are about protecting us starting a couple of weeks after they're delivered. And it's the public health measures now which are essential.
And Dr. Barrett, you called this modeling data terrifying. How concerned are you about ICUs being overwhelmed at this point?
Once again, I am incredibly concerned. The projected numbers of patients who are going to end up in ICU with COVID-19 related critical illness will far exceed our capacity. We are absolutely going to be relying on the surge measures that we used during wave 3. But it's going to be a lot harder this time because there's much fewer number of nurses that are working in our ICUs now. They're burnt out. They've taken leaves. So we're not going to have the same healthcare workforce that we had before. So yeah, it's really concerning.
Colin, today there was this call to reduce our personal contacts by 50% in order to blunt the Omicron variant. Do you think this message is clear enough to people? Why not just go back to that bubble concept?
I would prefer it if we did. I think the science table is doing its best to try and find a balance between what Mr. Ford's cabinet is willing to do and what we actually need. But I went for a walk just a half an hour ago, and I see restaurants packed full of people. Even if those restaurants were only half packed full of people, you've still got a super spreader event in every one as far as I can see. So there's a real disconnect between people's behavior right now and the rapid surge in cases we're facing. Unfortunately, I think we need stronger measures.
So what does that mean? I mean, we're talking about capacity limits now in these really big venues, anywhere with more than 1,000 people. But do you think we need to see limits put in place in restaurants and bars and even homes?
Well, what you just said is that we can easily have gatherings of 1,000 people. To me, that's unacceptable. I mean, that's absolutely unacceptable. We need to stop large gatherings altogether, not for long, but for a few weeks so that we can bring this down. This is no time to negotiate with the virus. We need to be far more extreme. And I just don't think Mr. Ford's cabinet is willing to do it, which is why we're in this pickle.
And the head of the science table said today circuit breakers with strong additional public health measures, at least 50% fewer contacts and strong booster campaigns, 250,000 per day could blunt the Omicron wave. What would a circuit breaker, I guess, look like this time? Dr. Barrett, yeah.
Oh, sorry.
Me. So a circuit breaker means it's a short, very suppressed rate of contact. So every single individual can think about the number of interactions that they're having with other people in indoor settings, add them up, divide by 2. If you have more than probably 50 in a week, you should probably be going lower than 50%. If you're having maybe 2 or 4 in a week, okay, go to 1 or 2. That means every single individual is reducing their contacts. It means if you can work from home, you're working from home. It means not going to that large dinner party. It means not going into the crowded mall if you can avoid it. It's every little additive contact is how this virus is being spread in our communities right now.
The head of the Science Advisory Table today is saying that he believes that we can get out of this without schools being shut down, without a lockdown. Do you think that's possible? Dr. Razak?
I think it's possible. And, Dr. Barrett gave very good examples of the personal behavior steps that you could take. And it's what I'm saying to my family. It's what I'm saying to my patients. But in order for us to protect schools and for us to at least allow the retail sector to have some meaningful Christmas season of sales, you have to then reduce capacity in other areas. And so the examples of restaurants being full, of bars being full, of large public gatherings of hundreds of people, you can't have all of it. So you have to prioritize. And, I think for most of us, we consider schools to be essential. And so when you're setting this list of priorities, schools should be the last thing to close and the first thing to open. That means you have to choose elsewhere. And the elsewhere is where there is a really important need to move the public health measures forward.
We know too, Colin, there's pandemic fatigue. There's been really pandemic fatigue for months, if not longer. There's concerns about non-compliance. If more rules are put in place, are you concerned rules won't be followed at this point?
I think that's always going to be a risk. I think the provincial government has invested a lot of time telling people the pandemic is over, even setting a date to rescind vaccine mandates, and people develop expectations based on that. I'm not sure it's raw fatigue so much as it is expectations that have been built up that we're through this. And to be told, within sight of the finish line that no, we have to go all the way back. Do not pass go, do not collect $200. That's really, really upsetting. So I think we could go back and look and see how the messaging was really flawed. But we're going to need to take this really seriously. And I think, for me, we need to close restaurants and we need to pay those restaurants to stay closed. That's what we need to do. And if you're fatigued, get takeout. If you're fatigued, go for a walk. But we really need to, I think, put structural things in place to close certain businesses. I don't mind stores. People are masked and going through stores. I think that's okay. But unmasked gatherings in stadiums and restaurants and going to gyms, that's got to stop, and we need to pay those businesses to stay closed. And then we'll be able to achieve what we need.
And Dr. Barrett, we've been talking a lot over the last few months of healthcare workers, the toll this is all taking on their mental health. Nurses, doctors, first responders, talk a little bit about that, especially now that we're so far along in this pandemic.
Yeah, healthcare worker burnout is a huge problem right now. We are all exhausted. There's a lot of compassion fatigue. And so, yes, it's a reality. And this is really unfortunate that it's coming at a time when I think a lot of us were really hoping that we could have some downtime with our families and celebrate the holidays. So I'd be lying if I didn't say that I was really devastated this weekend when I started to see the numbers. But we have to do our jobs, and we're going to show up for work, and we're going to be there for the patients that need us and the citizens of Ontario. We're just asking everyone else to do their part as well. And let's make this not so bad, because it's not going to be great, but we can make it less bad.
Okay, I like the optimism there, Dr. Barrett. Dr. Razak, there was some discussion today about the type of masks that we're using. Now we're being told by Dr. Uni to basically ditch those single-layer masks. What's your advice about this, and why is the advice changing?
The advice is changing because we know more now than we did 6 months ago, and definitely more than we knew a year and a half ago or 3 years ago. It's recognizing the fact that the virus is airborne, and it's stating that in order to protect against an airborne virus, the degree of barrier in what you're breathing in matters. So what does that mean practically for people? It means that a single layer cloth mask gives you very low levels of protection. You are going to be more protected if you can use, for example, a medical grade mask, which is a triple layer mask, which has been shown in large studies now to be very effective. There is always a question about whether you should then additionally wear a respirator mask. I have to say, as someone who wears that for work for long periods of time, those are very uncomfortable to wear. I don't know if they're realistic for most people. I myself, when I'm out and about, and my family don't wear N95 masks. I save those for when I'm in hospital caring for patients. But the medical mask should be the standard for most people now. I realize changing evidence is frustrating, but I think the other way to interpret those changes is to say people are watching the science very, very closely and trying to give you the best advice possible based on what we know.
And Dr. Barrett, before we leave you, I just want to ask you about elective surgeries, because we know a lot of those have been backlogged during the pandemic in earlier waves, and now, this is on the table again. How do you think that this is going to impact all those people that have been waiting for things over the last almost 3 years now?
I'm really sorry to say I think we are going to end up seeing many procedures deferred or delayed. Yeah, I think it's inevitable. It's the only way we're going to be able to surge up. So I'm very sorry for them, but it's going to happen again.
Colin, quick question for you before we wrap here. How should we spend the holidays? What's your final message when it comes to that?
Well, I think people should do what we're trying to do in our family, which is we are vaccinated to the extent that we can be. We are limiting contact to the extent that we can, which means most contact is now limited. We are at home as much as we can be. And before we gather for the holidays with other families, we are using rapid tests. The old folks are using them, the young kids are using them, and everyone in between. We are doubling down on rapid tests. They answer one important question. Are you contagious right now? That's all they do. And that's enormously useful when you're gathering together in a group. So we're doing those things.
Dr. Barrett, Dr. Razak, Colin Furness, thank you all so much for speaking with us tonight.
Thank you.
Great to be with you.
Good night.